My name's Teresa Ferricher, and this is my volunteer Kelly, and I'm doing my head-to-toe assessment for my health assessment class at Maryville University. Prior to coming in today, I took a full set of vital signs on Kelly, including height and weight. I had her empty her bladder, and in lieu of a gown, she's in a tank top and some pants. We tested her near and distant vision with the Snellen and Rosenbaum chart, which tests cranial nerve number 2, the optic nerve. We're going to go ahead and get started today. And as we start, I'm going to start with the head, and I'm going to inspect. I'm looking at her head. It's pink. It's normal cephalic. Her skin is pink, warm, dry. Her general appearance is, whenever she started, she's alert and oriented ×3, well-groomed, very appropriate in her actions and her comments. I'm going to go back to her head. Skin is pink, warm, and dry. Her eyes are set evenly on her face. Nose is midline. Her ears are lined up to the outer canthus of her eyes. Her ears are not lowered. I don't see any kind of lesions, any kind of wounds, any abnormalities. I'm going to palpate, and I'm going to feel of her skull. Her hair is very fine, evenly distributed, no alopecia that I noticed. I'm going to feel of her facial bones, her frontal, zygomatic, and mandibular, and I don't feel anything abnormal there. While I'm here, I'm going to go ahead and palpate sinuses, frontal and maxillary sinuses. Any tenderness noted there? No? Okay. While we're at this point, I'm going to go ahead and I'm going to test cranial nerve number 7, which is her facial nerve. And I'm going to have you clench your teeth. Okay. Wrinkle your forehead. Squeeze your eyes tight. Stick out your tongue. Puff out your cheeks. And I'm also going to test your sensation. And to make this as sharp or soft, with your eyes closed, please. Soft, soft, sharp, sharp, soft. And this also tests her trigeminal nerve, which is cranial nerve number 5. The other thing that I'm going to do is I'm going to palpate her temporal mandibular joint, if you'll open and close. I don't hear any clicking or any popping, any tenderness there. Okay. The other thing I'm going to go ahead and do is have you shrug your shoulders. This is cranial nerve number 11, the spinal axis nerve. You can relax there. I'm going to go ahead and move down to her eyes. And I'm looking at her eyes. They are even. They're symmetrical. I don't see any kind of drainage. Her eyebrows extends from the inner canthus to the outer canthus. Her eyelashes are outward and none are going inward. Whenever I look at her sclera and conjunctiva, they are, conjunctiva is pink and moist. Her sclera is white on both sides. No yellowing, no signs of jaundice. Whenever I'm looking at her eyes, I'm going to palpate her lacrimal apparatus. Any tenderness there? No. Okay. We've already done her vision screening, as mentioned earlier. I'm going to check her pupils. I'm going to do a function pupil response test, and I'm just going to shine my light in them. Just look straight ahead. Okay, and I'm going to do the cover-uncover test. So again, just look straight ahead. Okay, and we're going to test the other. Okay, and those are both normal. The last thing I'm going to do with her eyes is I'm going to check cranial nerve 3, 4, and 6, which is oculomotor, trochlear, and abducens. And I'm going to check these doing her 6 fields of gaze and looking for extraocular movements. Just follow my finger with your eyes only. Okay. And I don't see no extraocular movements. Also, no drooping, tests of the eyes, no sagging. They both look very even, symmetrical. I'm going to go ahead and move on to her ears, and I'm going to palpate her auricle, both sides. I don't feel any masses. Is anything tender? Okay. They look even. They are again lined up with the outer canthus of her eyes. We're going to do a whisper test. This is testing the acoustic nerve, which is cranial nerve number 8. This tests her hearing. We're going to cover one ear and repeat what I say.
Apple.
And the other ear?
Yellow.
Okay, and that is normal. Next, we're going to do the Weber and Renee test with the tuning fork. I'm going to put this on your head and just tell me if you hear this one side, the other, or both. Okay, and that's a normal finding. I'm going to put this behind your ear, and I want you to tell me when you can no longer hear it, and then I'm going to pull it away and put it by your ear and do the same. And that's the Renee test, and air to bone should be 2 to 1, so that's a normal finding as well. I'm going to look in. I'm going to look in her ears at her tympanic membrane, and the external ear looks good. No cerumen. The tympanic membrane is a pearly gray. I don't see any type of rupture. I'm going to look at the same thing on this side. Again, external ear looks good, and the tympanic membrane looks good. I'm going to go back and check the red reflex with the ophthalmoscope on her eye. I forgot that earlier. I'm going to do my right eye to her and left to left. Okay, and that is present. Okay, I'm going to move on from her ears to her nose. Again, her nose is midline. Looks symmetrical. Her septum is in the middle. It's midline. I'm going to look at the mucosa in her nose. I'm looking for it's pink, moist, turbulence, they're not. There's no edema noted to them. Nothing that is occluding the airway. I'm going to check patency. Take a deep breath. And again. Okay, very good. And I'm going to do the mouth and pharyngeal. We're going to look inside her mouth. I'm looking at her lips first, and her lips are moist. There's no cracking, no bleeding, nothing that looks abnormal on her lips. Let me open up. And I'm looking at her buccal mucosa, and it looks pink and moist. Her tongue is symmetrical. There's no abnormalities noted there. I'm looking at her uvula, and it's midline. There's no edema present around the uvula. Her tonsils look like they have been removed. No redness or drainage noted. If you will, raise your tongue up. I'm going to looking at her soft and hard palate. There's no signs of any type of oral cancer under her tongue. I'm going to look at her teeth. They're white. I do see 6 fillings. And I see, it looks like 28 teeth having her wisdom teeth removed. And I'm going to have you say, ah. Okay. And I'm going to check your gag reflex. Okay. And this is checking cranial nerve 9 and 10, glossopharyngeal, and vagus. And then stick your tongue out for me. Okay, lift it up, down, side to side. And this is checking cranial nerve number 12, which is her hypoglossal nerve. And that is all normal. So I'm going to go ahead and move down to her neck. Her neck, again, on inspection, is pink, warm, dry. It's center of her shoulders. I'm looking at it. I don't see any pulsating masses. I don't see any JVD. I'm going to palpate on her neck. I don't feel anything that's abnormal. I'm going to feel her carotid pulses side to side. Her trachea is midline. And if you'll swallow, please. Okay. Her thyroid seems normal. It raised up whenever she swallowed. I'm also going to check active and passive range of motion. If you'll bend your chin to your chest and your head back, look side to side, and then ear to shoulder on each side. Okay, and then go against my hand. and back, and side, and side. And her active and passive range of motion both are good. I'm going to go ahead and listen to her thyroid and trachea. Just take a deep breath. And breathe normal. I'm listening with the bell of my stethoscope. I'll listen to her thyroid. And I don't hear any bruise noted in either area. That all appears to be normal. So the next thing that I'm going to do is I'm going to check her lymph nodes. And with her lymph nodes, I'm looking for hardness, any tenderness. So if there's anything tender, let me know. I'm looking for any tight masses. So we're going to start with the occipital. And we're going to do the postauricular and the preauricular, the tonsillar, the submandibular, and the submental. And then I'm going to do the superficial cervical, the posterior cervical, and I'm going to do the deep cervical, and this side. And I'm going to check her supraclavicular, and I'm going to go ahead and do her infraclavicular. And if you'll raise your arms up, I'm going to check axillary. And that's all of her lymph nodes, and they all appear normal, no hardness, and it appears to be no tenderness. So I'm going to go ahead and move to her upper extremities, and I'm looking at her shoulders and arms. Her shoulders, there's some nevi present on her shoulders, sporadic. She's pink. She's warm and dry. No edematous noted. Her hands look good and smooth. Nail beds are cap refills less than 3 seconds. Her nails are smooth. Go ahead and put your arms up like this and push against me and pull. Okay. And I'm going to check your brachial pulses and your radial. And same on the other side. And that all looks good. So now I'm going to go ahead and have you turn around for me, and I'm going to do your posterior chest, your back. And I'm going to start just with inspecting, and I'm just going to look at her back, and I'm looking, I don't see any kind of wounds. Her respirations look even. Her respirations are unlabored. Her skin, again, is pink, warm, and dry. Looks symmetrical on her back. I'm going to palpate lightly and just kind of feel, I don't feel any abnormalities. I'm going to palpate her costovertebral angle. I'm going to percuss. And I'm going to do check for costovertebral tenderness. And any tenderness there? No? Okay. And I'm going to do thoracic expansion if you'll take a deep breath. Okay. And one more time. Okay. And I'm going to check for tactile fremitus if you'll say 99.
99, 99, 99, 99.
Okay. And I'm going to percuss. And I'm going to have you take a deep breath in, and I'm going to check your diaphragmatic excursion. Okay, and I'm going to mark that. Okay, and breathe. And it's right at 3 to 5 centimeters, which would be a normal finding. And the next thing that I'm going to do on the back is I'm going to auscultate, and I'm going to listen to lung sounds posteriorly and laterally. Deep breath. And that's all of that part. I'm going to have you go ahead and turn back around. Alright, and we're going to do the anterior chest now. And again, I'm just going to start with inspecting. Her skin's pink, warm, and dry. Her respirations look even. I'm going to lightly feel, feeling for any thrills or heaves or pulsations in her pericardium, and I don't feel anything there. I do note again a few nevi present here. I'm going to, I see that her respirations are not labored at all. I'm going to palpate the chest wall. Any tenderness there? Okay, I'm going to feel for her apical pulse. Okay, and that is good. I'm going to do tactile fremitus again, saying 99.
99.
Okay, and again, posterior and anteriorly, there's no increased or decreased tactile fremitus. So the next thing we're going to do is percuss. Okay, and all sounds are normal whenever I'm percussing. The next thing that I'm going to do is I'm going to listen to her anterior chest, her breath sound, and her heart sounds. Okay, we'll do breath sounds first. Deep breath. Okay, in and out. Okay, and breathe normal. I'm going to do heart sounds. I'm going to do her aortic, pulmonic, Erb's point, tricuspid, and her mitral. Okay, and all of that appears normal. The next thing we're going to do is an abdominal assessment. So if you'll go ahead and lay down for me. And there you go. And I'm just going to start by looking at her abdomen. Her abdomen looks pink, warm, and dry. I see some sporadic nevi. Looks like she had a cholecystectomy. These scars are healed very well. I'm looking at the contour, and it's flat. I don't see any hernias. I don't see any pulsations. I don't see any abnormalities there. The next thing I'm going to go to is I'm going to inspect. I'm going to auscultate, and I'm going to auscultate her bowel sounds. All 4 quadrants. Bowel sounds are active and equal. I'm going to listen to her arteries, her aortic, her renal, I'm doing this with the bell of the stethoscope, her iliac, and her femoral. The next thing that I'm going to do is I'm going to percuss, and I'm percussing the liver borders. And you hear dullness over the liver, and the liver borders is 6 to 12 centimeters. Hers is right at 10, so that's normal. I'm going to percuss over the spleen, which again, you expect to hear dullness. Okay. The gastric area, you would hear tympany. And then I'm just going to percuss over her abdomen. Okay. And all of those findings are normal. The next thing I'm going to do on her abdomen is I'm going to do palpation, and I'm going to start with soft palpation. I'm feeling for muscle mass. I'm feeling for any kind, again, any thrills, any pulsations, hernias, and I don't feel anything. Any tenderness with that? Okay, and I'm going to do a deeper palpation now. I'm going to palpate her liver. Okay, and I'm just going to palpate down in her abdomen, around her umbilicus. Okay, and I'm going to feel for her kidney. Okay, and it feels normal. Okay, and for her spleen, I'm going to have you roll up on your side. Okay, and I'm going to palpate deep on the left intercostal margin. And a lot of times the spleen is not palpable, if so, that's a sign of enlargement, and I'm not able to palpate hers, which is normal. And again, her muscle mass is normal. And I'm going to let you go ahead and stand up, or sit up, please. The next thing that I'm going to do is I'm going to inspect your legs and your feet. Your skin is pink, it's warm, dry. I don't see any kind of edema. I'm going to look at her pulses. I'm going to check her popliteal. I'm going to check her posterior tibia and her dorsalis pedis, and the other side as well. Those are all normal and equal. Her toes, there's no abnormalities noted. Her toenails are smooth. Her cap refill is less than 3 seconds in her toes. Tell me if you feel the sensation. Okay, and I'm going to check your reflexes and do your brachial first. Okay, and your patella. And your Achilles. And those all seem normal. I'm going to check your muscle strength. If you will pull against me, okay, and push. Okay. And I'm going to, we did the cranial nerves throughout the exam. The only cranial nerve that was excluded through the exam was the cranial nerve number 1, which is the olfactory, and that is smell, so we excluded that. I'm going to go ahead and have you stand up and just squat for me so I can check your hip and knee flexation, or the ability to flex, and you did fine there. I'm going to have you go ahead and bend forward. And here I'm looking at the alignment of her shoulders and her hips, and they're aligned well. I'm looking at her spine, and her spine is in line. I don't see any curvatures of the spine. I'd be looking for scoliosis, and that all looks good there. You can stand back up. Okay. And I think that is it, and that's going to conclude our exam. Thank you very much.